If you are over 60 and your knees ache, your fingers are stiff in the morning, or your hips complain with every step, you might think it's just wear and tear. But rheumatologists in Australia warn that certain joint pains after 60 actually signal silent inflammation, autoimmune disease, crumbling bones, and even hidden cancers. Today you'll learn the 7 joint pain patterns older Australians dismiss as just arthritis that really need urgent tests, and the simple moves that can keep you walking, independent, and out of a wheelchair.
From your mid-50s onwards, joint complaints almost become a national soundtrack in Australia. Knees that hate stairs, hips that protest every time you get up from a low chair, fingers that feel stiff in the morning and ache when you try to open jars. Most people shrug, smile wryly and say, "Ah well, it's just arthritis. Comes with age." But here's the truth older Australians rarely hear clearly enough. Not all joint pain is just wear and tear, and even osteoarthritis itself is far more treatable and modifiable than most people realize. Some pain patterns are red flags for dangerous conditions: rheumatoid arthritis, gout and pseudo-gout, septic arthritis, joint infection, fractures, osteoporosis, and even cancers spreading to bone. The phrase "it's just arthritis" has delayed more diagnoses, more life-changing treatments, and more chances to stay mobile than almost any other sentence in older people's health. This video exists to replace that phrase with something far more powerful. What type of joint problem is this? And what can we still do about it? What actually happens to joints after 60 joints and not simple hinges? They are living, dynamic structures made of cartilage, bone, ligaments, tendons, synovial lining, and fluid. With age, several changes occur. Cartilage thins and becomes less springy. Synovial fluid quality changes. Muscles around the joint weaken if not used. Tiny bone spurs, osteophytes, can form. These changes contribute to osteoarthritis, the classic wear and tear arthritis. But on top of that, older Australians often carry old sports injuries or workplace damage, extra body weight putting pressure on hips, knees, and feet, diabetes or metabolic syndrome, autoimmune tendencies, years of repetitive strain from certain jobs or hobbies. So yes, some pain really is plain osteoarthritis. Yet even that is not a fixed sentence. Exercise, weight loss, targeted physio, and joint injections can dramatically change pain, mobility, and the need for surgery. More importantly, some pain patterns are not osteoarthritis at all, and ignoring them can cost you joints, independence, even life. Osteoarthritis versus inflammatory and other serious joint problems. Typical osteoarthritis features: pain worse with use, better with rest, stiffness after inactivity, but easing after 10 to 20 minutes of movement, asymmetrical. One knee worse than the other. One hip, a few finger joints, bony enlargements on finger joints, Heberdin and Bouchard nodes. No major systemic symptoms, no fevers, weight loss, inflammatory. Autoimmune arthritis, e.g. rheumatoid arthritis, psoriatic arthritis, morning. Stiffness lasting more than 30 to 60 minutes, joints warm, swollen, tender to touch, often symmetrical. Both hands, both wrists, systemic symptoms, fatigue, low-grade fever, weight loss can damage joints quickly if untreated. Other serious causes: gout, pseudo-gout, sudden, severe pain, red, hot joint, often big toe, ankle, knee. Septic arthritis, joint infection, acute, excruciating pain, very hot joint, fever, feeling very unwell, a medical emergency. Fracture or bone collapse, sudden hip pain after minor fall or twist. Vertebral fractures causing sudden back pain. Cancer spread to bone, deep, persistent bone pain, especially at night, with weight loss and fatigue. Learning to tell these patterns apart, or at least knowing which are not okay to ignore, is one of the main goals of this video. Why older Australians underreport joint pain, and why that's dangerous. Many people over 60 have been taught not to complain. They grew up with messages like, "Don't whinge, everyone has aches and pains," or "doctors are busy with real problems." They worry about being seen as weak, needy, or a burden, so they keep quiet. Others fear the solution. If I tell them about my hip, they'll just say I need surgery. If I admit my knees hurt, they'll tell me to stop driving. These fears lead to years of silent suffering, gradual loss of mobility, muscle wasting, falls, and preventable disability. But here's what rheumatologists, geriatricians, and orthopedic surgeons want you to know. Early joint pain is when you have the most options. Before joints are destroyed, you can still build muscle to unload the joint, reduce inflammation to stop damage, lose weight to reduce load, use targeted injections instead of surgery, treat underlying autoimmune disease, prevent fractures by treating osteoporosis. The longer you wait, the fewer options remain. Real stories. Just arthritis versus correct diagnosis. Helen, 67, Perth. Just arthritis that was actually rheumatoid arthritis. Helen's fingers were stiff and painful every morning. It took over an hour before she could properly hold a cup or do up buttons. Her GP told her, "It's just arthritis. You're getting older." She took over-the-counter pain relief and tried to put up with it. By the time she saw a rheumatologist 2 years later, several finger joints were already permanently deformed. Tests showed rheumatoid arthritis. Aggressive treatment slowed further damage, but some changes were irreversible. If someone had taken my morning stiffness and fatigue seriously earlier, I might still be able to do all my sewing and gardening like before. Frank, 74, Sydney. Hip pain that was actually a fracture. Frank developed sudden hip and groin pain after stepping awkwardly off a curb. He assumed he'd pulled a muscle. He limped for a week, taking painkillers, sleeping poorly, barely moving. When he finally went to emergency, unable to bear weight, X-rays revealed a fractured neck of femur. He needed urgent surgery. His bone density test later showed severe osteoporosis. If I'd gone in straight away, they might have pinned it without needing a full replacement, and I could have started bone strengthening treatment earlier. How this video will help you over the next 2 parts, you'll learn the 7 specific joint pain patterns that are not just wear and tear, which symptoms demand urgent care versus routine GP review, how to talk to your doctor so your pain is taken seriously, the tests that actually matter, X-ray versus MRI versus blood tests, what you can still do at home today to protect your joints and independence, the 3 golden rules before we dive in. New or rapidly worsening joint pain after 60 is never just age, until proven otherwise. Hot, red, extremely painful joints and sudden loss of function are emergencies, not waiting room problems. You are never too old to benefit from joint treatment, physio, or pain management. Moving well at 80 is absolutely possible with the right help. Part 2. Body. THE 7 joint pain warnings older Australians ignore. Warning number 1. Morning stiffness lasting more than 30 to 60 minutes, what it looks and feels like. You wake up and your hands feel like wood. Your fingers won't bend properly. Your wrists, knees, or ankles feel glued in place. It takes an hour or more of moving around, showering, and warming up before you can function. This has been happening most mornings for weeks or months. Why it matters: short stiffness, 5 to 15 minutes, can be osteoarthritis. Long stiffness, over 30 to 60 minutes, strongly suggest inflammatory arthritis, your immune system attacking joint lining, synovium. Common causes: rheumatoid arthritis, polymyalgia rheumatica, psoriatic arthritis. Clues: it's serious, symmetrical, both hands or wrists or feet warm, swollen joints, fatigue, low energy, maybe low-grade fevers, weight loss, or feeling generally unwell. What to do? GP appointment within 1 to 2 weeks. Request: inflammatory blood markers, ESR, CRP, rheumatoid factor, anti-CCP, ANA, autoimmune screen. Referral to rheumatologist if abnormal or strong clinical suspicion. Early treatment can prevent joint destruction. Warning number 2. Sudden, severe joint pain that appears over hours, what it looks and feels like. You go to bed fine and wake up with an ankle or big toe that feels like it's on fire. The joint is red, hot, swollen, exquisitely tender, even the bedsheet touching it hurts. Or your knee blows up over a day, painfully swollen and warm. Why it matters: this pattern screams gout, pseudogout, or septic arthritis. Gout, uric acid crystals in joints, common in older men, but also women after menopause. Pseudogout, calcium pyrophosphate crystals, often knees and wrists. Septic arthritis, joint infection, can destroy cartilage in days, and spread infection through the body. Clues: it's an emergency. Possible infection: fever, chills, feeling very unwell, joint extremely painful to any movement, recent skin infection, wound, or surgery. You're on immune-suppressing medication or have diabetes. What to do? If you suspect infection, emergency department now. If classic gout without systemic signs, GP same day or next day. Joint fluid analysis and blood tests needed. Warning number 3. Joint pain with night sweats, weight loss, or unexplained fatigue. What it looks and feels like. Aching bones or joints, especially at night. You're losing weight without trying. You wake drenched in sweat. You feel exhausted even with adequate rest. Why it matters. This can suggest systemic disease, cancer, especially blood cancers like myeloma or metastases to bone, inflammatory diseases, or serious infection. Clues: it's serious, deep, constant bone pain, not just joint pain, worse at night, not related to movement, persistent fevers or infections, marked loss of appetite. What to do? Urgent GP appointment within days. Ask for full bloods, inflammatory markers, protein electrophoresis, and imaging, X-ray, possibly CT/MRI. Early detection is critical. Warning number 4. Hip or groin pain after even a small twist or fall. What it looks and feels like. You misstep off a curb, twist slightly, or have a slow sideways fall. It doesn't seem dramatic, but afterward, you have groin or lateral hip pain, especially when bearing weight. You can maybe still walk, but with a limp, so you assume it's a strain. Why it matters. In older adults, even minor trauma can cause hip fractures or subtle cracks, stress fractures, especially if you have osteoporosis. Hip fractures are medical emergencies. They carry high risk of complications and loss of independence. Clues: it's serious. Pain in groin or outer hip when standing or walking, inability to bear full weight, or you collapse when trying, the leg looks shorter, or foot turned outward. Pain worsens rather than improves over 24 to 48 hours. What to do? If you can't bear weight or pain is severe, ambulance or emergency immediately. If you can walk but pain persists, GP or ED within 24 hours and insist on X-rays. If X-ray normal but pain continues, MRI may be needed. Warning number 5. New back pain with height loss or sudden posture change. What it looks and feels like. You develop sudden mid-back pain after lifting something light or even after coughing. Over weeks, you notice you're shorter and your upper back more stooped. Clothing fits differently. Friends say, you've shrunk. Why it matters. This pattern screams vertebral compression fractures from osteoporosis. These tiny collapses in the spine can be extremely painful at first, then settle, but leave permanent deformity and increased risk of future fractures, including hip and wrist fractures. Clues: it's serious. Pain is sharp and localized after trivial strain. You've lost 3 cm plus in height over the years. You have risk factors. Age 65, postmenopausal, long-term steroids, family history, low body weight, smoking, high alcohol. What to do? GP appointment within days. Request spine X-ray and bone density scan, DEXA. Osteoporosis is treatable. There are medications that significantly reduce fracture risk. Don't wait until the next fracture. Warning number 6. Small joint pain with skin or nail changes. What it looks and feels like. Fingers, toes, or wrists ache and swell. Some fingers look sausage-like, dactylitis. You notice pitted, ridged, or thickened nails, or red scaly patches on your elbows, knees, scalp, psoriasis. Why it matters. This suggests psoriatic arthritis, an autoimmune inflammatory arthritis linked to psoriasis. It can damage joints quickly and is often misdiagnosed as just osteoarthritis if the skin signs are subtle. Clues: it's serious. History of psoriasis, even mild scalp or nail disease. Pain in joints at ends of fingers and toes, entire finger or toe swollen, morning stiffness and fatigue. What to do? GP appointment. Request referral to rheumatologist. Modern treatments, DMDs, biologics, can control the disease and prevent disability. Warning number 7. Just arthritis that's suddenly much worse. What it looks and feels like. You've had mild, manageable osteoarthritis for years. Suddenly, over a few weeks, pain escalates. Joints swell more. You're losing mobility fast. You can't do things you could do a month ago. Why it matters. Rapid change suggests something new on top of your existing arthritis. Infection, crystal arthritis, gout, pseudo-gout, into a damaged joint, new autoimmune disease, or progression to severe osteoarthritis needing urgent management. Clues: it's serious. Sharp change over weeks. Not years: new swelling, warmth, or redness. Systemic symptoms: fever, fatigue, weight loss, pain waking you at night and present at rest. What to do? GP appointment within 1 to 2 weeks. Don't accept it's just your old arthritis getting worse without bloods and imaging. Part 3. Conclusion. Your joint-saving action plan. Step 1. Track your joint symptoms for 1 to 2 weeks. Note: which joints hurt. Draw a simple body map. Time of day pain is worst. Morning versus evening. Stiffness, duration after waking or resting, swelling, redness, heat, impact on daily activities, stays, dressing, cooking. Bring this to your GP. Patterns matter. Step 2. Know when it's an emergency. Go to emergency or call an ambulance if a joint is extremely painful, hot, swollen, and you have fever, chills, you can't bear weight after a fall, or sudden pain, you have sudden severe back or hip pain and can't move, you have known cancer and new severe bone pain. These situations can be septic arthritis, fractures, or spinal emergencies. Every hour counts. Step 3. What to ask your GP for. Say clearly: my joint pain is affecting my daily life. I'd like to make sure this isn't inflammatory arthritis, gout, infection, or fracture. Can we do the right tests and consider a specialist referral? Ask about blood tests, inflammatory markers, rheumatoid factor, uric acid, autoimmune screen, x-rays of affected joints, MRI or ultrasound if needed, bone density test. If you have fracture risk, referral, rheumatologist, orthopaedic surgeon, or pain clinic depending on findings. Step 4. Build a joint-friendly movement plan. Even with arthritis, rest is not the answer. The right movement is. Low-impact cardio, walking, cycling, swimming, water aerobics. 30 minutes most days. Strength training, 2 to 3 times per week. Focus on legs, hips, core, flexibility, and balance. Tai Chi, yoga, gentle stretching. If pain is a barrier, ask for a physiotherapist experience with older adults. They can design a joint-safe program and show you how to move without making things worse. Step 5. Weight, shoes, and joint load. Every extra kilogram puts several extra kilos of force through hips and knees with each step. Work towards a realistic 5 to 10% weight loss. If overweight, choose cushioned, supportive shoes. Avoid flimsy flats and high heels. Consider orthotics or shoe inserts if foot mechanics are contributing to knee, hip pain. Small changes in load can make a big difference in pain. Step 6. Pain relief. Safe options for older Australians. Topical NSAIDs, gels, creams, safer than tablets for many older adults. Paracetamol, in appropriate doses, but alone often not enough. Oral NSAIDs, use with caution, can harm stomach, kidneys, heart. Always discuss with doctor. Joint injections, corticosteroid or hyaluronic acid in selected joints. Heat, cold. Heat for stiffness, cold for acute inflammation. Avoid long-term opioid use where possible. High risk of side effects and dependency in older adults. Step 7. Treat the bones. Osteoporosis matters if you're over 65, especially if female or with risk factors. Insist on bone density scan, DEXA, calcium and vitamin D status if osteoporosis is diagnosed. Medications like bisphosphonates, denosumab, or others can halve your fracture risk. Preventing one hip fracture can literally save your life and independence. Step 8. Autoimmune arthritis. Don't miss the window if inflammatory arthritis is confirmed. Modern MRDs, disease-modifying drugs, and biologics can put disease into remission. Starting treatment within the first months of symptoms leads to the best outcomes. Leaving it to see what happens often means permanent joint damage. You are not too old for these treatments. Age alone is not a reason to miss out. Step 9. Adapt your home, not just your expectations. Simple changes reduce pain and fall risk. Raise toilet seats and chairs, grab rails in bathroom and near steps, non-slip mats. Remove loose rugs, frequently used items at waist height, not low cupboards or high shelves. These are not concessions to old age. They are smart strategies to keep you independent. Step 10. Change the story you tell yourself instead of, "It's just arthritis. Nothing to do. I'm too old for treatment. Pain is part of aging." Try. "My joints are giving me information. I need to understand why." There are still treatments and exercises that can help me move better. The earlier I act, the more independence I keep. Your goal is not a pain-free, perfectly young body. Your goal is a body that lets you do what matters. Walk, dress, socialize, travel, play with grandkids, live in your own home. Joint care after 60 is about protecting that freedom.